I think you are muted, Johanna.
Yes, I'm muted.
Yeah.
Was trying to. It's working.
I think you are muted, Johanna.
Can you hear me?
Yes, I can hear you.
I'm muted. Yeah. Was trying to.
There is a delay in the sound, a very strange echo and delay in the sound. You are muted. You are muted.
Yes, now. Yeah, I was trying to set up. So now it's now I
check if the Zoom works well now.
Yeah.
Because the YouTube will be delayed compared to Zoom. So you can't have it on your screen. The live stream will be like a bit laggy.
Yeah, it's a bit delayed when we speak what's.
Yeah, but your Zoom should be fine. So you should hear each other in the.
Yeah, we are having a conversation, but how can I check here the.
Talk with the other person now.
Yeah.
Can she hear you there?
Can you hear me?
Yes, I can hear you. Fine.
Good. Yeah. My husband is trying the.
Yeah.
So it's working. So I put that other link in the.
Yeah. No, so it's working.
Okay.
Just share that.
Yeah.
YouTube,
I'll just have to share this. Yeah, we are live.
Okay.
All right. Just share that link here on the PCOS. Edit profile. Links. Thank God I'm not an influencer because difficult. Paste here and then here and then the correct link here. Just posted it again on the PCOS. And then to watch to look at if there's a question. If there's questions coming, let's see here, we can watch yes. So this is us on YouTube. Yeah, and then the chat. What is the chat? Here's the live chat. There is no, where is the chat? Maybe I can ask Anne-Helen if she's.
Do you want me to call Anne-Helen?
No, to just check with her if she can post a question, if we can see it. because I don't see here a possibility to.
I'm happy I'm not in charge with the technicalities.
It's different because I had set the YouTube live on YouTube and then I should have gotten a code, but now I did it different. So I added a live stream from Zoom. So it's a bit different. But let me put this in silence so I don't get. It's 1:30. Can you see me and hear me? Well, because now the sun came. So I have the questions here. So I'll just, introduce you and give you the floor to,
Yes, yes.
Yeah. It's at 1:29. See here. I don't see the questions here. Now it's 1:30, so I want to welcome everyone to this live stream, our first ever live stream with Dr. Esther Banki. She's a researcher and professor in the University in Trondheim, and her area of research is PCOS. So today we'll be speaking about a new clinical trial for youth with PCOS or young women with PCOS in the ages of 12 to 23 years old. And yeah, what are the implications of this treatment? Who can get to participate in the treatment? And yeah, some of the general aspects of what is PCOS, what is the diagnosis criteria and information for providers as well as for patients. So welcome, Dr. Esther Banki.
Thank you very much. Happy to be here with you.
Yes. And yeah, so this is an event as part of the PCOS Awareness Month. So we wanted to, to highlight different aspects of PCOS. Yesterday, we were talking to PCOS advocates in the Nordics, in Denmark, Sweden, Iceland. So there's some strong patient organizations in some of the countries, and there's some challenges in trying, to build this community and this advocacy work from the patient perspective. So I'm very happy that you're here. You've been collaborating with us since the beginning of PCOS Norge, and we see that together, there's like a stronger voice from the research perspective, evidence-based, treatment and options. And then from, it's like a feedback you hear from the patients.
Yes.
And
yes, I completely agree. It is very important, this patient engagement, this consumers aspects into PCOS. It is very important, and I'm very happy to cooperate with the PCOS Norge. It has been very helpful for me, and hopefully I have been helpful for you too. So yes, absolutely.
Yes. We're very grateful. So today we're going to speak about SPIOMED for health, right? It's
Yes.
a clinical study for a possible treatment of PCOS for young women.
Yes.
First, I wanted to hear from you your story. How did you get involved in researching PCOS?
Yeah. Well, I'm a gynecologist, and as a young gynecologist for 20 years ago, 25 years ago, I met patients with PCOS, and I had no clue what to do about them or how to help them, except of that if they did not have ovulations and wanted to be pregnant, and we could stimulate ovulations, but that was it. And it was extremely little information in our textbooks from a med school, or at that time we didn't even have a net. So that made me very curious about PCOS. And I met my former supervisor, a professor of endocrinology, Sven Carlsen, who introduced me to the field of PCOS research. And then we together set up several clinical studies for women with PCOS.
So you're one of the pioneers. I mean,
Oh yes, one of many pioneers. Yes, probably.
Yeah. And yes, tell us a bit about what you are researching.
Research about PCOS has traditionally been focused on how to help women with PCOS to become pregnant, those who cannot become pregnant naturally, spontaneously. But my focus has been actually not that part, but mostly on for pregnancy. What happens when they are once pregnant? What happens in their pregnancy? What happens to their children, and so on? So that has been my main focus, but of course also women, non-pregnant PCOS women.
So can you tell us a bit more about how
PCOS?
Yeah, about PCOS.
So PCOS is a very common condition. It's 1 out of 8 women worldwide have the condition. However, it may vary very much from very mild symptoms, which do essentially not affect life or life quality so much, to very severe symptoms that affects a major part of your life. So not everybody with PCOS need treatment and need help, but many do. And the problem is that PCOS is not diagnosed. Many women have a PCOS, struggle with symptoms without knowing that they have the diagnosis. So I think the first step forward is that if a woman or a girl suspect or think that, well, I might have PCOS, then go to a doctor. This doctor can be a GP, a general practitioner, or an endocrinologist or a gynecologist, and ask the doctor, well, I have this and this and these symptoms. Do you think that I might have PCOS? And then the doctor has very good guidelines today, both national guidelines and international guidelines, to check out, because not everybody can have in their head immediately how to deal with PCOS, and then find out whether the girl or the woman has PCOS. And that's the first step. Because when the diagnosis is settled, it's much easier to get more information and also get help and good advice how to manage, how to deal with PCOS.
And when you speak, if you could speak to the provider, can you name some of the guidelines we were talking before?
Some of the guidelines, yes. This year, we have launched the International Evidence-Based Guideline on assessment and management of PCOS. This is the second time we launch it. The first time it was launched in 2018, and now we have revised and added international. This is the largest and best ever guideline that actually looks at almost all parts or all aspects of PCOS. This has been created in cooperation with lots of different specialties and also with women with PCOS. They have been in the process during the entire timeline, during each meeting, and advised us how to deal with PCOS. It has been very professional librarians and statisticians who put together all data, and then it has been an expert panel of 4 groups who looked at the data and then translated it, or interpreted it to the guidelines and advices what we should do. And this is very, very important. That is the most reliable source we can have to help us and help women with PCOS.
Thank you.
This is free for everybody. This is very easy to get through the internet, and this is free for everybody.
Yeah, and we can add the link to the description of this live so people can access it here, both for practitioners and for patients, because it also
absolutely or relatives, everybody. Yeah,
so it's very comprehensive, very up-to-date, and evidence-based. So this is very good. Can you talk a bit about the Spiomet for Health as a new treatment, because there is no actual approved treatment for PCOS, right? At this time. So what is the...
So essentially, the treatment for PCOS depends on where in life you are. Of course, a girl or a young woman of 20, when she comes to a doctor with irregular menstruations or increased hair growth or losing their hair or lots of acne, put on weight quickly, she might have a very different problem compared to a little bit older woman who wants to become pregnant, or even an even older woman who are before menopause or after menopause and have difficulties with blood sugar control or hypertension or increased weight, whatever. So the symptoms and problems are different. So the treatment is also dependent on what the most important symptoms and problems are for the patient. We have very little treatment to offer the youngest group of the women with PCOS. And I'm now talking about those girls who are 2 years after their first menstruation. That might be girls between 12, 13, 14-year-old up to 23 years of age. In these girls, the problems are most often the irregular menstruations, increased hairiness, persistent acne, and also weight gain that is difficult to cope with. And for these girls, until now, we have essentially only treatment that treats the symptoms but does not do anything with the underlying problems, with the underlying physiological, pathophysiological problems. And in this Spiomet study, we are trying out a medication combination of 3 different medications. All drugs are in very low doses. And the idea is that this drug could stop the negative circles which drives obesity and then high androgens and high inflammation, and results in less ovulations, less menstruation, increased hairiness. You can stop this process and even reverse it to a certain degree. And the idea is that most people, when they have excess food, as most of us have excess food, we store this excess energy under our skin, an underskin fat. Everybody has underskin fat, almost everybody. But women or girls with PCOS have probably a reduced capacity to store fat under the skin, and instead they store fat inside the body, in the liver and around the viscerals. And that is the kind of fat that is the bad guy. This is the visceral fat, what they call, that gives us increased inflammation, increased male hormones called androgens, and also insulin resistance. Insulin resistance is that you don't respond to insulin, but you need to have higher and higher insulins to a certain degree, and then your blood sugar starts to raise. So this and the idea that these three medications together will actually increase the brown tissue. The brown fat tissue is the tissue that burns, that consumes energy, while the white tissue is what we have in the abdomen that stores energy. So this is the first attempt to try to reverse the process of PCOS, the start of PCOS.
Yeah, very interesting, and a very different approach, right?
Yes. Yeah.
Treating symptoms.
So in this Biomet for Health, we have it is not only having this pill to take, but this is a study that goes for 12 months with the medication and 6 months with a follow-up. And all girls who can join the study and who can be included to the study will have also lifestyle management, a lifestyle advice, lifestyle coaching that is about healthy eating, not necessarily that go home and reduce your weight, but it is about healthy eating, about physical activity, about stress reduction, coping with stress, and also about sleep hygiene. We call it sleep hygiene, how to achieve good sleep habits. And this, everybody gets this. And everybody has a lot of examinations with ultrasound, with MRI, with DEXA scan, measuring the content of both this visceral fat and subcutaneous fat, bone, muscle mass during the study. We will take blood tests. We will measure the vessels, the thickness of the vessels in the neck, and everybody gets this. And then the girls will be randomly set into randomized to 4 different groups. 3 of the groups will have some combinations of these 3 medications, and one of the group will have the so-called placebo, that is a tablet without any active drug. So the possibility to have an active drug is 75%, while there is a possibility to have the placebo is 25%. And we will not know who gets what, and the girls will not know what they got until the entire study is finished.
So you really get very thorough follow-up and understanding of
Yes,
the
yes,
body,
yes, yes.
your condition. That's really, I mean, a
And
benefit.
the fantastic thing is that in Norway, this study is run in Norway and 6 other countries, and it is a EU finance study, the largest financial support to PCOS research ever from the European Union.
Wow.
But in Norway, as we run this study in Norway, we are so lucky that the girls who want to participate but do not live in Trondheim, but in other parts of Norway, they can have a free tour. They don't have to pay for their travels to Trondheim, but this will be covered by Pasientreiser.
So they will have to travel.
They would have to travel to Trondheim.
Every third month?
Yes, about 7 to 8 times during this 1.5 years. They have to have a 1-day travel, the same day to Trondheim and the same day back home. Yes.
And I had a question also, because we're talking about very young girls.
Yeah.
But the new guidelines talked about, diagnosis. It's kind of difficult in this period until you get to be an adult. So yeah, can you tell us a bit about what are you looking?
Oh, yes.
Yeah.
Thank you for that question, because that is a very important question. The new guideline, this international evidence-based guideline, states very clearly that doctors should be very careful and reluctant to set the definitive PCOS diagnosis on girls before 19, 20 years. And the reason is that there are so many girls having irregular menses without having PCOS. There are so many girls having acne without having PCOS. They might be girls who have increased hair growth, but they don't have PCOS. So the idea is that girls who have these problems, they should be discussed PCOS with, they should get help, but the definitive diagnosis should be re-evaluated when they are out of their teenagers, in 19 or 20 years old. So it should be re-evaluated before a definitive diagnosis. So that is important. So in this study, we are looking for girls that have symptoms of PCOS, or if they've got the diagnosis of PCOS from a doctor. So all girls who think they might have PCOS and who have read the criteria that needs to be filled up in order to join the study, they can contact us and we will help them to decide whether they can participate in the study or not.
Thank you. Also, can you speak about what's the difference between the current criteria that we were using and the new guidelines also for young women?
Yeah. So the criteria to get the PCOS diagnosis for grown-ups, those who are above 20 years, that is, they must meet 2 out of 3 criteria. And one is to have seldom irregular menstruations, less than 8 menstruations a year, or longer periods than 35 days. That's one criteria. The second criteria is that they have high androgen levels, either by a blood test or by having increased male type of hair growth, like having hair on the lip or on the chin or up to the umbilical or inside of the thighs, the back of on the back, so on. So that is the second. And the third is to have so-called polycystic ovaries, many small cysts on the ovaries. So 2 out of 3 criteria is enough, and then the doctor should take some blood tests to exclude other diagnoses that may mimic PCOS. So this is for adults. And for young girls, they should have both irregular menstruations, but then it can be irregular up to 45 days cycles. Or if it's a longer cycles, then we call it irregular menstruations. And they should have high androgen levels or increased hairiness, but we don't look at the ovaries like in adults, because most young girls, or many young girls, have multicystic, small cysts on the ovaries, which is normal and natural in the start of the fertile age, and so we don't pay attention to that. Yeah.
So no ultrasound.
So no, it's not necessary. No, it's not necessary. And of course, the blood test and the diagnosis, when we set the diagnosis of PCOS, it should be done when she is not on any oral contraceptives, hormonal contraceptives, or pregnant, of course. Yeah.
Yeah. So I think we discussed a bit, but just to recap, what is the role of SPIOMET in the treatment or in the possible treatment of?
The role or the aim of the SPIOMET is that with a combination of low-dose drugs, achieve regular ovulations, regular menstruations, probably weight reduction, and also to reduce the androgen levels, so the girls would have a reduced hairiness or less acne. So that is the main aims. But we are looking at the menstrual regulation first and foremost. But we are also asking the girls about their quality of life, of how they feel, their psychological health. Yeah.
Yeah. And yeah, now that you mentioned and that also, I saw that the new guidelines address also that, the emphasis on taking a look at the whole picture of depression.
Very important. It's very important, yes.
Not only about fertility, or not only about regulating. Yeah.
Absolutely, you are right.
So what are some of the lessons learned so far in the research in the SPIOMET? If you can share some of the non-confidential.
Yes. Our experiences are that actually many girls have been interested in the study. We wish that it was even more who are interested, because not everybody can join the study. We have certain criteria. The girls, there are very few, or we have no serious side effects. There are some side effects, but we can manage it. Most girls like being in the study and feel safe and well taken care of. We have only had 3 out of almost 30 girls who have dropped out of different reasons. So most of the girls like to be in the study and feel safe, and they are supported by their parents, of course.
So what would you say to someone who is thinking, I might fit the criteria, I might, be interested to participate?
If you are prepared to be in the study for 1.5 years, and if you are prepared not to be on hormonal contraception, but we will help you to have a non-hormonal contraception like an IUD, copper IUD, then contact us. If you have seldom menstruations, increased hairiness, if you got the PCOS diagnosis, and you want to learn more about your PCOS, you want to contribute to research, please contact us, and we will get in a dialogue and find out together whether this study is interesting and suited for you, and you are welcome.
Yeah. What about if, I mean, I get this question now, what about if they're in contraception, but they're willing to stop it? Is it also possible? Yeah.
Then they have to stop contraception for 3 months, but I will, free of charge, set in a mini copper IUD designed for girls, and that will prevent that they can get pregnant, of course.
Okay, and then one last question: what would be the? I know we're part of this multi-country study. What are the implications overall internationally? You know, for
what
the treatment?
If we get the results that we hope for, that this combination of tablets actually makes ovulation more regular, decreases weight, decreases the visceral fat, reduces androgenicity, reduces inflammation, then it would be a fantastic first option to these girls, instead of just having the combined oral contraceptives to lean on in young age to reduce symptoms. So that would be a big win. Yeah.
And would you say that these 3 medications, could you speak a bit more about what they are and how they
I can.
work?
Yeah, they are low dose of spironolactone, pioglitazone, and metformin, and they are in the 3 of the 4 groups. They are in different combinations.
Because you've been studying a lot metmorphin, right?
Yeah.
And it's been effective in reducing some of the
what metformin has been used for women with PCOS in non-pregnant women with PCOS, and has some effect, yes, and it is also advised as a baseline treatment. But here in this study, we are trying out a combination with other drugs that will have additive effect.
Very, very interesting and promising, and we encourage both patients, and also we want to have a last call in for providers also. If you have young girls that come to you that are, that you think are fitting some of the criteria, please, offer these young girls the possibility, to participate, to get treatment, to get to know the condition, because it's a vulnerable, as you mentioned, it's a vulnerable group that so far has no other treatment. So
yes.
Any last remarks or any last comments?
Oh, you are very welcome to contact us anytime, but the last patients to enter the study will be in March, April. So after that, the study will be closed because we have to finish it. So please, if you are wondering, if you want to participate, have a call, write an email to us, and let's find it out together.
Before next year, next March.
Yes.
Okay.
Thank you very much.
Thank you for taking the time to talk to us. And yeah,
Oh, it's a pleasure. It's a pleasure. Thank you very much.
thank you. Bye.
Bye.